health is concerned, the WHO, the World Health Organization Constitution, has given three parameters of health. These are physical, mental, and social. So, as for WHO, the definition of health goes like this: the health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But something has been added by Indian culture, that is spiritual health. That the fourth aspect, ayam of health, is spiritual health. Keeping the definition of WHO as well as Indian definition of health in view, we will be proceeding towards this presentation under these following heads. And these heads are concept of hospitality as regards Sanatan Dharma is concerned, and the Maslow's hierarchy of needs is concerned. The second one will be the components of hospitality, then monitoring process of hospitality, and at last, happiness of the patient or satisfaction of the patient and their family. As regards Sanatan Dharma concept, as per Sanatan Dharma is concerned, we say the रोगी हमारा भगवान है और उनके रिश्तेदार and परिचित हमारे मेहमान हैं. The patient is our God and their relatives and attendants are our guests. Atithi, Devobhava. In Sanatan Dharma, any guest coming to your place, whether in your home or at your workplace or anywhere, that person is considered as guest. And with keeping in that view, in 2021, we had adopted this concept or values as regards this hospital and the group is concerned, and that was patient is our God and their relatives and attendants are our guests. This is the concept. At least we are following, or almost 100% or 99% of people working in this hospital, they are following this concept of hospitality. As regards Sanatan Dharma is concerned, we people are aware, God Ram, when he went to the jungle for Banvas, and Sabri Mata, she was waiting to look after God, and she offered beer, whatever, and after tasting those beers, कि मेरे भगवान को कड़वा beer न मिले. That was the aim behind that, or the भावना behind that. उसको हम कह सकते हैं, हम कहते हैं कि सबरी ने अपने झूठे बेर खिलाए. कंसेप्ट ये है, और दूसरा कंसेप्ट ये है कि मेरे भगवान को, जो मेरे गेस्ट हैं, जो मेरे यहाँ आए हैं, उनको कष्ट ना हो, उनकी टंग में कोई भी कड़वी चीज ना चली जाए जिससे कि उनको कष्ट हो. The second example in Sanatan Dharma, जो त्रेता युग, क्या नाम है, भगवान कृष्ण वाला युग था, द्वापर, when his school time friend, he comes to his place, Sudama ji, and you must have seen in fact TV serials, what has been shown in those. Krishna Bhagwan, he runs and reach up to the Sudama, who looks after him, washes his feet with his tears. When he sees the condition of Sudamaji, he is so poor, no chappals, clothes are torn, nothing to eat. no shelter. After seeing that, Lord Krishna, he starts crying or weeping, and with his tears he washes his feet. That was the level of hospitality in Sanatan Dharma. Keeping that thing in mind, and we will be going ahead with the presentation today. And the second concept is hierarchy of needs. There was a psychologist, Maslow, and that Maslow, he has defined a triangle. He has given a triangle of needs, a triangle of hierarchy of needs, and grossly that he has given 5-6 parameters and then modified Maslow's this thing. But basically, this triangle was divided into 3 parts: the physiological needs and the basic needs. Roti, kapda, makan. Once the physiological needs are met, then only person thinks of other things like security, good food, good transport, etc. And then when these needs are met, then person thinks of higher order needs. He requires some relaxation in the form of yoga. भगवान भी तभी याद आते हैं जब पेट खराब होता है. But what are basic needs? Roti, kapda, makan, food, clothing, and shelter. These basic needs are even for an animal. An animal also requires food, some form of shelter, and some form of covering in case of any like rains and all. Then comes the middle order needs. The middle order needs that includes, as per Maslow also, security, best communication, facilities for people around, luxurious items, better laundry, better variety in foods, etc. When these things are met, then higher order needs like yoga, meditation, prayer, etc. As regards basic needs, in our hospital is concerned or in healthcare setup is concerned, roti, food and beverages, they should be prepared in hygienic condition. The quality should be good and in sufficient quantity. The taste should be palatable. Services, abrupt services on time, timely services. If we have given time at 12 o'clock for the lunch, then should be provided at 12 o'clock. Or if some patient comes around 10 o'clock in the night and if there is requirement of feeding you something, you can't say no. The food has to be provided. Then comes the kapda, like the uniform of patient's uniform. Why patient's uniform? Because firstly they are cleaned as per the requirement of hospital, and secondly the identity of the patient, so that the patients can be identified whether for their treatment or for their other purposes also. Then includes the bed sheets, blanket, other laundry, etc. As regards this shelter or makan is concerned in basic needs, what is requirement of patient is the patient's ward or patient room, it should be clean, properly set up, clean washrooms with all other type of amenities. The second part is the middle order needs. The middle order needs are, once the basic needs are met, then person or any person or patient looks for luxury in the room. Like you are seeing this in this room, the patient needs, patient demands. The room should be air conditioned. There should be TV. There should be a telephone. Once these are met, then good sitting arrangement with best quality food. Good sitting arrangement for patient as an attendant and the best quality food. Security needs. Vehicle arrangement, what type of ambulance we are providing? AC-less ambulance or normal ambulance. Otherwise, the normal ambulance without any facility is a patient carrying vehicle. It is like a bus. And then facilities for their attendants. This basically the waiting area that is shown, which we have in our hospital, especially for the attendants, those who come for counseling or if they want to meet any management person. As regard quality of food is concerned, there is a system of food tasting in this hospital, or there should be a system of food tasting in all hospitals or all healthcare organizations. Regularly, in fact, we have defined the days or earmarked the days who will taste food on which day or which day. This is the way the food is being presented to the patients in the hospital and should be presented like this. As regards security is concerned, the security should be alert at all times with regards to safety of the patient, with regard to safety of infrastructure, with regard to safety of all other arrangements, all other facilities available in the hospital. This normal ambulance shown here, this big ambulance, the ACS ambulance. Once these vital order needs are met of any patient or the attendants, then the patient or attendant, they demand for, there should be some temple or space for prayer so that we can pray for our patient. भगवान का भी याद आता है, या तो पेशेंट ठीक हो गया, थैंक यू गॉड, थैंक्स गॉड, या अगर ठीक नहीं हो रहा है, ऊपर जाने के मूड में है, तब भी भगवान याद आता है, तब भी जो है उसमें भी हायर ऑर्डर नीड्स, नॉट ऑफ पेशेंट, अटेंडेंट्स, दे रिक्वायर दी mental support or psychological support, and for that purpose the higher order needs of patient as well as their attendants, including relatives, there has to be a prayer place in each and every hospital. We had a small prayer place in our hospital, as well as we have a temple adjacent to our hospital. So attendants and the relatives are advised whenever they need this thing, whenever they are coming to the hospital, they must pray to the God for benefit of their patient, and in case they are not satisfied, then the nearby temple can be used for that purpose, for prayer purpose. You are seeing yoga, this thing. In fact, in the Medanta hospital, they have employed, I think, 2 or 3 yoga trained people also. I have met them 2-3 times whenever I visited that Medanta hospital. Since we are a smaller hospital, so we are not able to employ yoga teacher. What are components of hospitality? You are seeing here in any hospital setup, we have management team, doctors, nurses, front office, operation people, dietitians, security, maintenance team, supporting staff in the form of GD and housekeeping, and other departments. You are seeing here, in fact, during clean hospital lecture, at that time also I have advised you people, I have told you people that the hospital has been divided into two portions, two type of this thing. Facility wise, one is the hospital care where patients are treated or investigated directly, and the hotel type of area where patients are provided with the facility which are available in hotel source. So that's the reason. As regards this hospitality team is concerned, the hospitality head is concerned, this portion, this part is controlled by or headed by the hospitality head. Then in the hotel type of place or hospitality department, the front office, operations, admin, security, housekeeping, maintenance, food and beverage department. Here some processes have been written: admission process, transfer process, shifting process, operations, discharge process, billing process. Here we have written here the hospitality starts as soon as a patient thinks of going to any healthcare center. As soon as, whether the patient is at his home or at any incident site, the site of accident or site of heart attack or brain stroke, whatever you may call it. So hospitality starts at incident site and the gate of the hospital, at both places. As regards this thing concerned, the wheelchairs, stretchers are available with belt and other safety items. It is necessary to have experienced nurse, doctors, GDA with the patient especially whenever you are receiving the patient. Here you are seeing the photograph. The patient is being received. Then start the admission process. As the admission process is concerned, it should be very, very prompt, and there should be simple process. Doctor should quickly check the patient. Nurses should help in checking the patient and the monitoring of the patient or assessment of the patient. Then, when this process is being done at the same time along with the treatment, the process of admission should also be fast. It should be going simultaneously so that there is no time is wasted as regards patient as well as the attendants are concerned. Along with comforting the patient's family, give them full support in admission process. Now, what is expected out of blue coat people or each and everyone sitting here is, suppose someone is asking you, where is this department? So please don't say you go to so-and-so counter, or you go to underground, or you go to second floor. As regards hospitality is concerned, each and everyone is supposed to be assisting the patient as well as their relatives. When I reported or joined the hospital 3 years back, this was the usual practice in this hospital. कि आप ऐसा करो नीचे चले, आप ऐसा करो उस काउंटर पे चले, आप ऐसा करो उस काउंटर पे चले. It is better to help each and every attendant as well as patient. Okay, don't say go to so and so this thing. If you are free, go along with the. This front office, admission process being shown. Again front office. Then shifting of patients. Once patient comes to the hospital, the shifting of patient starts from gate only. As soon as ambulance comes, who is supposed to be receiving the patient? RMO of casualty or the doctor sitting in casualty is in charge of the department. He must ensure that patient is received as soon as possible, promptly the patient received, safely patient and the patient safely received. We have to have concern for the safety of the patient also. We must see that whenever you are using any wheelchair, the belt is there. If you are using trolley, then properly the wheels are properly, the oxygen is there. Each and everything has to be checked. And whenever any person finds at reception or at the gate of the hospital where the ambulance has come, each and everyone, like suppose security staff or any other person or the maintenance people, if they are seeing there is only one GDA or housekeeping staff is pulling the stretcher or the wheelchair, they are required to support that staff. You cannot say, I am from security, I will not support, I will not help. Even drivers are supposed to be helping the GDA present there or the nursing staff present there, so that patient is carried promptly and safely to the emergency department. Once it is decided by RMO or the consultant or the doctor that patient is required to be shifted to any ward, then what process is required to be followed? Cleaning and sanitation of bed space in ward or room, wherever the patient is required to be shifted, whether that room or the bed space. Suppose the patient is being shifted to ICU 1 or ICU 2 or ICU 3 or SDU, where no rooms are there, but where spaces are allotted per bed. So that space, bed space, is required to be prepared to receive patient. Hygiene of washrooms with all amenities. Please see whether TV is functional, AC is functional, light fittings are okay, call bell is functional or not. Food hygiene, quality and quantity of the food. Okay. It is the responsibility of hospitality team, the housekeeping, maintenance, floor managers and IT, to give their clearance or to check whether they are ready to receive the patient or not. You are in this photograph, you are seeing the maintenance staff is checking the room whether the things are functional or not. You are seeing one of the private rooms ready to receive the patient. Once casualty or the ICU from where the patient is going to be shifted in semi-private or private room, you must get clearance first whether the room is ready or not. If the room is not ready or the bed space is not ready, in that case, the treatment of or management of patient will be delayed. Patient shifting is in progress. Here this person is changing the uniform of the patient in casualty. Some patients go to the ICU or other wards through investigation through radiology department. You are seeing the X-rays being taken. Sometimes patient goes through CT room or MRI room. You are seeing here the CT is being taken. When the ward is received, here you are seeing the same patient has these in one of the patient care area or one of the rooms. What monitoring process has to be there in any hospital or any healthcare setup? If things are going on smoothly or not? As regards this hospital and this group is concerned, here we have a special process in healthcare or a special process in hospitality. And that process is morning round of CEO or medical director. Wherever CEO is non-medical, then medical director is conducting the round. and CEO/medical director is required to meet each and every patient so that the highest person in the hospital, highest administrator in the hospital, is aware whether patient is being seen by doctors and his requirements have been met as regards accommodation, food, and other items. Then daily round by hospitality team. So what hospitality team is required to see is all these items, whatever I have told, except seeing of files of the patient. They are required to even know that whether the patient has been seen by any consultant or the required consultant or not. If there is any deficiency or any problem, they are supposed to be the hospitality team is supposed to be communicating with that doctor or consultant or department so that there is no delay in treatment and patient is satisfied and the patient and their attendant, his attendant or her attendant are satisfied. The patient satisfaction proves the success and failure of a work, whether it is hospitality or hospital care or health. Never say the principle of hospitality is never say no to anyone for anything. As long as patient is there in our hospital or in any hospital, as regards our values are concerned, the patient is our God. Keeping that thing in mind, please don't say no to any patient for anything. He's not going to ask you a golden ring or gold ring. He will be asking only for best care in the form of professional as well as other services. Our hospitality head is taking around here and she is communicating with patient, asking for any problem. This is a regular affair and this should be a regular affair in all healthcare sectors, in all type of hospitals. Here the dietitian is taking around, she is communicating with patient as regards what she is supposed to be doing, assessment of nutrition of patient. That's the reason the measurement of height and weight is very, very important in initial assessment by nursing staff in casualty. For example, for any region, if casualty staff fails in that, measuring the height and weight of the patient, then the ward staff is supposed to be taking the right. Once that thing is there, then only dietitian can assess the nutritional status of patient. Then comes the plan for any therapeutic type of diet, diabetic diet, salt-free diet, any other diet. The next responsibility of dietitian is the preparation of diet cards. The cards are being prepared for each and every patient separately. And as per that card only, the kitchen gives the food for that particular patient. The next function of dietitian is keeping the hygiene and sanitation of the kitchen at the highest level. The hygiene and sanitation of kitchen is very, very important. Then comes the palatability of food, the taste of food. So we say the food of hospital is very, very bland. Despite that, as per requirement of the patient and his or her problem, the palatability can be improved. Then comes the discharge advice. The dietitian is supposed to be giving the discharge advice when patient is being discharged from the hospital. Then comes the floor manager, nursing staff. The floor manager is supposed to be taking the regular rounds, to see whether whatever referrals have been advised by primary consultant, their referrals have been done or not. The files are being maintained properly or not. As regards these floor manager are concerned, there is a sheet as per NAP. Checklist. And that checklist is supposed to be filled up by floor managers, so that nothing is left. Thereafter comes the round of housekeeping manager. The housekeeping manager is required to report to the hospital early in the morning, because in any hospital, suppose the timings of hospital is 9 o'clock, then housekeeping manager is required to be coming at 8 o'clock or 8:30, so that he sees, he's in front of him only, the hospital is being prepared as regards cleanliness and sanitation is concerned. What he is supposed to be checking is housekeeping staff, monitoring of housekeeping staff, deployment of housekeeping staff, cleaning of rooms and the bed space, clean laundry and personal care of the patients. Housekeeping manager, pray, what personal care is expected out of you?
पर्सनल केयर लाइक सर, जैसे किसी पेशेंट्स को कुछ चाहिए आउट ऑफ सर्विस सर, लाइक जैसे बाहर से कुछ फ्रूट्स की
मॉर्निंग में कौन सी केयर की जाती है?
अच्छा, वो स्पॉन्जिंग केयर सर.
Sponging. जो पेशेंट, the patient, those who are bed bound or those who cannot move, their sponging is supposed to be done by your staff, by your attendants, sanitary attendants. Okay. It has to be done. Okay. The round of the housekeeping manager, once he has finished his job, he is taking feedback from the patient. Sir, are you happy? सफाई ठीक है कि नहीं? Then the maintenance round. Round by maintenance team. Important persons are plumber, electrician, AC technician, carpenter, etc. As soon as they receive any information regarding non-functioning or malfunctioning of any equipment, with regards to water supply, electricity, AC, they are supposed to be doing their work promptly. That's the reason the head of the maintenance team is required to visit hospital, each and every department of the hospital, each and every ward of the hospital, so that he is aware where is the problem. This maintenance team include Mr. Ravinder, gas wala jisko kehte hain. Okay, gas manifold. So that he is also aware, is there any supply of oxygen is okay or not? Is there any leaking of gas, oxygen or not? Your suction system is functional or not? Okay. Maintenance team is checking the hospital, basically toilets and this generator system. Then biomedical people. We have diploma and degree qualified biomedical engineers in hospitals nowadays. We also have 3 biomedical engineers here. And what they are supposed to be checking? They are supposed to be checking each and every equipment for their functioning. Whether it is BiPAP or monitors, or oxygen supply system, oxygen generation system. And in addition to that, call bell in this hospital, in our hospital. The maintenance of call bell is also under the biomedical engineers as regards our hospital is concerned. So one of the biomedical engineer, yes, you are seeing that biomedical engineer is doing something in the world. As regards security is concerned, the security head is making a round of the hospital, or supposed to be making a round of the hospital. For what? Deployment of security staff. Responsibility of security staff is what type? He is responsible for patients, staff, attendants, infrastructure, transport, etc. The security of each and everything in the hospital is the responsibility of security staff, including stopping of theft. That's the reason they have been ordered or they have been advised to check baggage of the patients or baggage of the staff, so that nothing is being taken away from this place. Administrative round. The director administration in our hospital or facility director in other organizations. Facility means this hospital is a facility. The facility director of the hospital or the director administration of the hospital, as regards our group is concerned, is supposed to be making round as soon as he comes in the hospital. As regards maintenance of hospital, whether it is cleaning, whether it is functioning of equipments, whether it is functioning of water supply, functioning of electricity, functioning of generators, functioning of your like cleaning of toilets, functioning of STP, UTP, each and everything is the responsibility of facility director or the director administration of the hospital. Now, this person, this boy belongs to GRE, guest relations. In fact, till 2019 or 18 and or 19 and we were not having any GRE person in our hospital. Guest relation executives. They are very, very important. जो कहते हैं ना important कड़ी in the chain. What they are supposed to be doing is they connect with all patients and listen to them. They must have good ears. सुनने की क्षमता इनमें बहुत होनी चाहिए. अगर GRE गेस्ट रिलेशन एग्जीक्यूटिव में सुनने की क्षमता है तो आपकी बहुत सारी प्रॉब्लम्स को सॉर्ट आउट कर लेगा. बहुत सारा जो डिससेटिस्फैक्शन है वो GRE इसको सॉर्ट आउट कर सकता है. क्या है इस टाइप का? They connect with all patients, listen to their problems and sort out the same as soon as possible. There is no time wasted कि कल करूंगा. No. As regards GRE is concerned, then and there the problem has to be sorted out. You can't tell any person कि सर कल देखेंगे. Unless until you sort out the problem of patient or the attendant, you cannot leave the hospital. If you leave the hospital before sorting out the problem, in that case, you are leaving a problem for other people. You are not doing your work properly as regards patient satisfaction is concerned. They are also supposed to be interacting with other departments. There must be some problem related to other departments. So GRE person, they interact with other departments also. Like Prem Singh, Mr. Prem Singh, he had come to this hospital as guest relation executive. And today, because of his good work, he is functioning as hospitality manager. Okay. Here you are seeing the hospitality head, DG hospitality is visiting the patient. they try to know about the services of our hospital. GRE and hospitality head, basically the GRE comes under the hospitality head. But hospitality head has his or own responsibility of deeply asking the question, or deeply inquiring from the patient and their attendant, or observing. The hospitality head is supposed to be, even without asking anything, they are supposed to be noticing things. This thing is going wrong here, without asking anything. The hospitality head has to open his or her eyes, ears. Try to know about the services of our hospital, and if there is any obstacle in the care of patient, then she takes immediate cognizance of this problem. The solution galat word hai. Cognizance of the problem, so that any solution can be found. Activity at the time of discharge. Floor manager, what floor manager is supposed to do? Discharge process as soon as possible. In fact, today only we have made one flow chart for the discharge process, and it will be explained to all tomorrow what process is being followed and should be followed in our hospital henceforth. The role of GRE, they are supposed to be taking feedback at the time of discharge. What type of feedback? Feedback in the form of written feedback in prescribed format. In fact, we are following the format issued by ECHS organization and the Google feedback or any other type of feedback. What is the role of RMO? Explain discharge summary, medication and patient care after discharge at home. The role of RMO here is the patient is already being treated or has been treated. Now the patient is going to home. At that point of time, the responsibility of RMO as regards hospitality is concerned to brief patient and their attendants regarding what to do once you reach home, how to take the medicine, what precaution you are supposed to be taking, what type of exercise you are supposed to be taking. That briefing is supposed to be done by RMO of the ward with help of nursing in charge of the ward. Dietitian, what dietitian is supposed to be doing? Giving diet chart related to food at home as per the disease or problem of the patient. Here you are saying the hospitality head is interacting with the patient at the time of discharge. The patient is very happy. You can see the happiness on the face of the patient or satisfaction on the face of the patient. Here, the final process of discharge, you are seeing each and every one is smiling or satisfied. That's the reason they are standing behind. Otherwise, mental खड़े होते हैं मेरे सामने. Thank you.